Our next question has been asked more than once, and this could be answered by Dr. Bashir Tawouli, and also Dr. Siegel can also contribute. What should be the approach for incidental COVID-19 suspicious findings on CT in patients who undergo imaging for indications other than COVID-19? So management of incidental COVID-19 on chest CT. Is it
So on the imaging, we had actually a bunch of cases on CT and MRI, even on MRI. Actually, we had recently, for instance, a pregnant woman who had an MRI, fetal MRI, with findings of COVID-19 on the lung basis. So it's not infrequent. And then we have a template report that says that there are lung CT findings or lung-based findings that could be suggestive of viral pneumonia. We don't say COVID-19 because we're never sure. And then what happens is we usually notify clinicians that there's a possibility that this patient may have COVID-19. And to be honest with you, a lot of these patients actually are already PUI, meaning persons under investigation, or they're already considered. But sometimes they don't know, and then they need to get tested immediately.
Dr.
Right.
Siegel,
Yeah, I would agree. Testing would be indicated, but again, remember, people with mild disease don't need to be hospitalized. So testing would be indicated, but it would depend upon the patient's clinical condition whether or not they would need to be in a hospital setting.
Okay.
But it's important to test them if they go home to be isolated, that kind of stuff. So
Agreed.
So thank you very much, Dr. Siegel and Bashir, for answering this question.